Hey everyone, it's Chad again with Frontline Legal Services, and I am coming to you with part 5 of HIV 101. So in this presentation, we will be discussing PrEP, or post-exposure prophylaxis. So post meaning after. PEP means basically taking medicine to prevent HIV after a possible exposure, and it should only be used in emergency situations and must be started within 72 hours after a possible exposure. So it's important to speak to a doctor right away if you feel that you may have been exposed. Such examples would include during sex if the condom breaks, through sharing of needles, or equipment used to inject drugs, or if you've been sexually assaulted. The sooner PEP is started, the better. And if you're prescribed PEP, it's important to know that you have to take it every day for 28 days. It is for emergency use only. If you feel you're at ongoing risk, speak to your doctor about getting on PrEP, or pre-exposure prophylaxis, which is a preventative measure. PEP is safe, but it may cause minor side effects such as nausea in some people. In most cases, side effects are treatable and aren't life-threatening. So paying for PEP, depending on the reason you're prescribed, you may qualify for free or low-cost PEP medications. So take a moment to review the following screen, which should have some resources, on places you can contact depending on your situation for PEP assistance. And I'll be back with you shortly. All right, so now that you have reviewed the previous information, let's continue. So if you think you've been exposed to PEP at work, see your healthcare provider immediately, an emergency room doctor, or an urgent care provider. It's important to also report your exposure to the appropriate person at work as well. And again, in this case, as in any case with PEP, it must be started within 72 hours of possible exposure. The careful practice of standard precautions can help reduce the risk of exposure while caring for patients living with HIV. Clinicians who are caring for workers who have had a possible exposure may call the PEP line, PEP line, at 1-888-448-4911. If you have been possibly exposed at work, your workplace healthcare insurance or workers' compensation will usually pay for PEP. However, if you can't get insurance coverage, your healthcare provider can apply for free PEP medications through the medication assistance program run by the manufacturers. And then also the Gilead's Advancing Access program that we mentioned in a prior video, I think it was the PrEP video, can help as well. And applications can be faxed, completed online, or over the phone. So yeah, that's it for PEP, pretty much, pretty straightforward and whatnot. So stay tuned. Part 6 will be the last part, which will discuss what happens if you receive a positive diagnosis from the doctor for HIV. So stay tuned, and I'll be back with you soon.